Dr. Jeffrey Irvin joins us on the podcast today from La Ronge to help us understand the reasons. Dr. Irvin, welcome to the show.
Alicia, thanks very much.
First, I just want to hear you put this in context for us. How significant is it to have more than 24 cases in the community?
Yeah, I think you sort of mentioned it already, that just single cases, little pockets every once in a while pop up in the medical community, and everyone takes notice with this. And so now that we've come across the 27 and counting, we stopped counting after 27. It could have been more after that, and we're anticipating there was more. We just haven't tested for it. It's a surprising thing to us, but yeah, it's more of a recognition of all the concerns that go around behind this. It's not now a vitamin C issue. It's more of a underlying social determinants of health issue that's just brought forward.
Yeah, and I want to hear all about that. But to even hear you say that you stopped counting after 27, that's quite something.
Yeah, our sort of initial data stopped counting it in May of 2024, so earlier this spring, and we came across the 27 at that time. We haven't stopped testing. We're still testing appropriately. We're not doing widespread testing. We're not advocating for widespread testing that we test sometimes for diabetes, for example. We want to test everybody just to see, but we're not advocating for that. We're just still testing appropriately when people come in with possible signs of scurvy. We're still testing for vitamin C for that. We're just not capturing it within our data anymore because we know it's there now. We don't need more information to prove that it's there. We now want to do something about it.
So how did you first start to discover these cases? Maybe take me back to when this came on your radar and other doctors' radar.
Yeah, it was one of the physicians at the La Ronge Medical Clinic, of which I work with. We have a group of family physicians, and we serve the northeastern part of the province. And one of the physicians was seeing a patient that had a few sort of vague symptoms that the physician didn't really sort of know where to go with it. It didn't really have a particular diagnosis for it. So this physician went back and did some more investigations in terms of reading some textbooks and going online to some medical sort of literature and looking at sort of other possibilities of what this could be. One of the differential diagnoses, or one of the options that was listed, was scurvy. The physician hadn't really thought of that initially, appropriately so. Like, we don't see scurvy very much, or we don't think we see scurvy at least. But for completeness sake, the physician ordered a vitamin C test, along with a few other tests to investigate this further. The vitamin C test came back as undetectable, meaning that it's very low levels of vitamin C in this patient. Upon further questioning as a follow-up, really sort of started to make sense that this patient started to have these symptoms after not consuming sort of vitamin C healthy foods over the past many months because of food insecurity, and the other symptoms that they were having all fit within the diagnosis of scurvy. The physician now started to have this on the back of their mind with other patients that they were seeing with similar presentations, started to test more for vitamin C, and more popped up. And so they started to sort of share within our physician group about other possibilities that people might be presenting with this because of the lack of healthy foods or access to it in northern Saskatchewan. How
much vitamin C does a person need?
It varies a little bit based on who you are and what type of things you do. Sort of an average male, adult male, about 90 units per day is sort of what we consume. Females slightly less, pregnant women slightly more. If you smoke, even more than that because of the sort of harmful effect that tobacco smoke can cause on the body. Your body needs a little bit more vitamin C for that, but that's approximate, which is really just maybe an orange and a half a day or a cup of broccoli a day. So in terms of what you consume, not very high amounts, but it still needs to be consumed. Our body cannot make vitamin C. It could many years ago. We had the genes to do that. Somewhere along the line, we lost that ability. So now we have to consume it. It doesn't take much, but it still needs to be consumed.
But you need it. And I've heard you mention food insecurity. We've been hearing that. Jordan McPhail is the NDP MLA that represents part of the North. And here's his take on things.
As a dad of two growing girls, I know that food can cost a lot of money. And for folks that are in northern Saskatchewan, when you're adding milk to your Rice Krispies, whatnot, to add a little bit of nutritional value, adding a $20 price tag to that, not a whole lot of bowls of cereal can go on a jug of milk these days. So it makes it tougher and tougher for families to decide what they're going to be feeding their children. And so to me, again, when we see $20 jugs of milk and $20 cases of grapes here, that's a huge challenge to making sure that kids and adults alike are getting a well-balanced diet anywhere in northern Saskatchewan.
$20 grapes. That's hard to comprehend. Just how do you think food prices have affected people in the north? And how has that led to these cases of scurvy?
Yeah, I guess this leads into some of the social determinants of health in terms of, and what I mean by that is sort of the non-medical factors that still influence your health. And so, for example, food insecurity is a non-medical factor, but still affects your health. Housing, income, and education. And if all of your income is going towards food, then you can't work with anything else with it. And so all this excess money now that is trying to go towards just living, housing, for example, can't go towards these expensive healthy foods. The northern average food intake for a family of four, for example, for a week is about $460 for a week, compared to the south average about $780 a week. So almost twice as much money for a healthy food basket for a family of four. This compares to the income of northern Saskatchewan. Is median income is much less than the median income of southern Saskatchewan. So it's not like northern Saskatchewan populations are earning more money, so therefore they have the extra disposable income to spend on this pricey food. But no, it's completely the opposite. So people aren't going to be able to spend all this extra money on extra food. They just don't have the extra money in order to do that.
What else might be happening in the lives of some of the people who are presenting with these symptoms of scurvy? I'm thinking about, do they have a roof over their head? Are people dealing with a substance use disorder? Like, what else might be going on in their lives?
Yeah, and I think that's exactly what we're sort of trying to talk about in this situation is as well. That is, it's not a vitamin C issue. It's a whole social determinants of health issue. As a physician, I have a very hard time speaking with people about eating healthy foods when they don't have a roof over the top of their heads. A lot of the population in northern Saskatchewan and low social economic statuses don't have stable housing. That's more important to them than eating the vitamin C rich foods that might be available to them. That's just not on their radar right now. And so those are some of the things that we have to actually look at as a sort of population in a medical health perspective about. You can't just focus on the food. It really is a holistic medical endeavor.
What would people be eating if they're not able to afford fruits and vegetables? I'm just wondering what people are gravitating towards in your community.
Well, it's much easier to ship processed packaged foods into northern Saskatchewan. You don't have to keep them cold. Their shelf life is much longer. It's therefore cheaper to send them that direction, and therefore it's much easier for people in sort of the north to gravitate to eat these particular foods. The calorie density is much higher too, so it keeps you fuller for longer. The nutritional density may not be as high though, and so they're not getting the nutrition for it, but at least they feel full and they're at least able to eat something. With the price being lower too, it's much easier to reach for these type of foods on the grocery store shelves, and so they're just not getting the nutritional foods that we're encouraging people to have.
Mm-hmm. How likely is it that we do have more cases? I mean, you said you stopped counting at 27, but before you answer that more fully, I just want to share with you again something that we heard from NDP MLA Jordan McPhail. This is his take on it.
Treated the 27 cases of scurvy in La Ronge, but the government can choose to see this as a canary in the coal mine. In a place like La Ronge, where there is road access, where there is a grocery store, they can look further north into places like Stony Rapids, Saskatchewan, and wonder what deficiencies are they facing there as well. It is a challenging test to get scurvy tested, but I'm sure that as you travel further north, the problems become worse and worse.
What do you think?
Yeah, I think Jordan sort of hit the nail on the head with that one. We have a few different cases that we've managed to find, again, only because of almost a bit of luck to be able to find it from this one physician. We don't test for it as a physician group. We looked back for over a decade about previously in our medical community and in our medical clinic about how often we test for vitamin C. It's extremely rare that we even test for it in the first place. And yeah, L'Orange is very easy to get to in terms of open road for the most of the time. We have a good grocery store here with a lot of different food, but further north, the farther north you go, the less available that is, the more and more expensive it is. So if we have some in L'Orange, it's bound to be much more prevalent in even smaller communities.
What are the chances that there are cases in the South? I'm even thinking about the cities, because we know that people are struggling with the cost of living. Something that I see a lot in Saskatoon is just how much people are struggling, people without a home. And when you don't have a home, sometimes you're turning to drugs to cope, to get through the night, right? It's very complicated. And so I wonder, what's the likelihood that we have cases of scurvy in our cities?
Yeah, food insecurity is not a small northern Saskatchewan out of the way issue. It's a national issue. I think last number I heard, I think was over 8 million people that felt food insecure in Canada, along with sort of housing insecurity that goes across the nation as well. This is not a northern Saskatchewan issue. Just because, again, we haven't been testing for scurvy potentially elsewhere doesn't mean that it's not elsewhere anyways. But again, I don't think it's mainly only a vitamin C issue. It's everything else that goes along with the vitamin C, the food insecurity, the income, the education, the housing issue. It's a grand scheme of things that makes it complex to try to deal with because of that. And people have been looking to work on this for a long time. And there's a few ideas out there in terms of how to work on this. But yeah, it's just not an issue only for northern Saskatchewan.
So what is the strategy in the short term? How do you get people's vitamin C levels up?
So research has shown that providing food education for people is not really as effective. For the most part, people know how to prepare food. It's more the access to food that is the issue. And even if they do have access, it's the ability to actually purchase the food and have the ability to get the food. So yes, maybe in the short term, we want a little bit of more education in terms of making sure they're aware of the signs and symptoms of scurvy, including physicians being able to watch for this a little bit. A little bit of education for the populations that may be more food insecure about what they should be watching for, but also some of the foods that we can start eating a little bit more in terms of what can be a little more nutritious. Focusing a little bit on the traditional foods, because if you can't have enough money to purchase the expensive foods, then maybe a little more of the traditional food might be a little more available.
Yeah, and I had a chance to speak to the chief of the Lac La Ronge Indian band, Tammy Cook-Searson, about some of that, because I wanted to know how she was reacting to all of this and what are some of the community solutions that people are talking about right now. So let's listen to Chief Tammy Cook-Searson.
I also learned that there's vitamin C in our traditional foods. So something that we harvest every year and that we consume quite often, such as mint, that we use in our mint tea. So we call them wigaswa. And then we also harvest Labrador tea. So that's something that's in abundance in the north. And it's something that's high in vitamin C. And then also rosehip or fireweed. So those are things that you can make into teas. And then also the animal parts, such as the liver, kidneys, and heart, which is something that we eat often too. Like anyone that gets a moose, like those are the delicacies that we eat all the time. And I didn't realize that they were high in vitamin C. So I'm learning too, as this is coming to light, that it's something to pay attention to, especially if someone is symptomatic, to get checked to see if they're low in vitamin C, because it is an easy fix.
And something I learned from Chief Cook-Searson is that you can harvest rose hips right now. Even though it's snowy out there, there's still a way to harvest some of those traditional foods, which I found really, really interesting. Again, though, in the short term, can people just take a vitamin? Is that an option?
Yeah, research has shown that the bioavailability, meaning the amount that your body sort of retains after consuming either vitamin C from food versus vitamin C in a tablet, it's actually pretty good and pretty equal. The chemical structure is exactly the same. How much your body absorbs is pretty much the same as well. So yes, just taking a vitamin C tablet can meet your vitamin C requirements. Now, it's not quite the same as food itself. There's so many other phytochemicals and other nutrients besides vitamin C that will be in the food. So we still advocate for healthy food eating. But in the short term, yeah, vitamin C tablets is much quicker than trying to fix whatever food insecurity issues and cost of living issues that we might have. At least we'll be able to get a little bit of vitamin C in them.
Yeah.
Again, though, you're just getting the vitamin C, though. You're not getting everything else in it. So just because we fixed scurvy, now we have still other nutritional problems. So it's not ideal.
Yeah, it's complicated. What's keeping you optimistic right now? This has gotten a fair bit of attention. It's pretty shocking when you look at the numbers, 27 cases of scurvy. So what's keeping you optimistic right now?
I think the discussions that are happening, like these issues are not new. Food insecurity is not a new thing. Housing insecurity is not a new thing. Social determinants of health have been around for a long time, but people are just starting to talk about it again in a new light, and that's sort of keeping me optimistic that way. We have the Jordans, as you mentioned, the NDP sort of calling for a stop in PST. We had today the federal government stopping GST on certain food things, and I guess, well, we can comment on that later, but people are meeting to discuss that at least a little bit, and we'll see how much further that goes along. But the discussions are happening, which is an important first step.
So good to talk to you today about this. I really appreciate it. Thank you.
Yeah, my pleasure.